virtual tour of the birth center. My name is Alex and I'll be showing you guys around today. We're so happy you decided to choose us for your birth experience and we're honored to help welcome your baby. So let's get started. We have lots of parking options when you do come to our unit. There are multiple spots in front of the birth center. Your support person is welcome to drop you off at the front and then repark the car after using our 30-minute loading zone area. If you arrive at the Childbirth Center in between the hours of 9 p.m. and 6 a.m., all you need to do is push this button. Our registrar will talk to you and let you into the unit. Here at the birth center, we celebrate over 2,000 births every year with our team of obstetricians, family practice physicians, certified nurse midwives, pediatric hospitalists, anesthesiologists, lactation consultants, and specialty trained RNs. This is our registration desk. This is where you'll be checking in before you enter our unit. We really are excited to welcome your baby, but we would love if you would call us ahead of time when you're on your way, when labor started. Another great thing to do is to call ahead of time and pre-register. This just helps your check-in process go smoother and a little quicker for you. Childbirth Center, we have a physician here 24 hours a day for your obstetric care. We also have 24-hour anesthesia available in case an epidural is part of your birth plan. Once you arrive, we'll check you in and evaluate you in one of our OB/ED triage rooms. If your labor has indeed begun and we're getting ready to welcome your baby, we'll move you into one of our labor rooms. We do have 10 labor rooms. And while you're here in labor, you will have your own nurse, and she'll be with you and helping you through the experience. This is one of our standard labor rooms. As far as your support person goes, there's an extra bed there for them. It's very comfortable. Here we have our rocker. It's a great option as far as comfort goes in labor. It's great for different positions and helping move your labor forward. Another option we have is using our birthing balls. We have a variety of options, including straight birthing balls and also a peanut ball for epidural positioning as well. All of our labor rooms do have a tub. Sometimes warm water can feel really nice with labor, and so we do have that as an option for you as well. Many people ask what items they should pack for their hospital stay. We have a comprehensive list available for you on the PeaceHealth website, but a few of the common items we recommend are a copy of your birth plan, a comfortable nursing bra, slippers, and comfortable changes of clothing for you and your support person, toiletries, chargers for your electronics, chapstick for during labor, and of course a car seat, blanket, and outfit for bringing your baby home. Please do not bring any valuables, perfumes, medications, or large, cumbersome items with you to the hospital. While you're here and admitted, we're going to actively listen to your baby while you're in labor. We have a couple of different options for monitoring. The first one is our external monitor, and those are little monitors on your belly. Another option is what's called the Monica monitor. That allows you for extra mobility and it's a wireless system, so that can be a really nice option as well. The other thing we have is a telemetry monitor. And that also allows for great movement if your birth plan includes being up and active. As your care team, one of our primary goals is to help support you in achieving the type of birth that you desire. Many of our patients that come in are low risk and want a low intervention birth. We have a number of options that can help support you in achieving that. One of the ways we can do that is by Dopplering. This is a way of monitoring that's very non-invasive and accurately tells us how the baby is doing inside. Here in our unit, we do a bedside shift report. So with each oncoming shift, you'll have 2 sets of nurses that will come in and talk about you as our patient. We also love to post your birth plans that you come to us with on this board. It's a great tool for communication for us. We also included an area for you guys to write questions if you have things that you'd like to ask us as nurses. And then as nurses, we'll also update this so that you as the family know how your labor is progressing and the current medications you've received and other risk factors that we need to pass on about your care. When writing your birth plan, it's a good idea to try to get all the important information on one page so it's easy for your team to follow. List the things that are most important to you in order of importance, and don't forget to include the contact information for your support team. It's also a good idea to list the primary care provider you have chosen to care for your baby. We highly encourage all of our laboring moms to have a saline lock place. This is for your safety and your baby's safety. If you do have questions about this, please ask your providers. The safety of you and your baby is our top priority, and we are constantly striving to ensure the care we provide is as safe as possible. We are a participating member of the Washington State Hospital Association Safe Deliveries Roadmap Learning Collaborative. We also provide nationally recognized continuing education to all of our providers and nurses, and routinely participate in interdisciplinary simulations to ensure we are ready for any situation that may arise. In the event your baby needs extra medical assistance, our Level 2 Special Care Nursery is located on the unit and staffed with specialty trained pediatricians, nurses, and respiratory therapists. Here in-house, we have pediatricians available 24 hours a day to help welcome your baby. Our cabinetry conceals most of our medical equipment, but this is the warmer. If we needed to, we can use this space to help take care of your baby. There's a heat source right here that helps keep your baby warm, and our resuscitation equipment is also included in this area. Once we deliver your baby, we will do skin to skin. That is one of our standards of care. The other thing we do routinely is delayed cord clamping. There's lots of benefits of skin to skin, including better bonding with mama. It also allows for initiation of breastfeeding to go smoothly, and it helps get mom's milk in a little sooner. If your baby needs to be born via cesarean section, we have 2 designated operating rooms that are a few short steps away from your labor room. If it's a safe option for you and your baby, we love to offer family-friendly C-sections. What that means is that we offer things like skin-to-skin back in the OR, keeping the family all together so that your baby's with you for the duration of your procedure, and then moving together as a family into your recovery unit. We also offer a see-through drink so that if you're comfortable with it, you can see your baby being born. It's a great opportunity for photos of your newborn. After your cesarean delivery is completed, you'll come from the OR to our ensuite PACU. Here you'll have 1 nurse, and then you can also have 1 support person back here while you rest and recover after your delivery. Once your baby's born, we'll place a hug security tag on his or her ankle. This allows us to see where he is or she is in the unit at all times. It's also for your protection so that no one can ever walk off with your baby. It's a top-of-the-line system, and we really like using it. We will also take footprints and a security photo of your baby to keep in our chart. Any caregiver safe to handle your baby will have a teal color on their badge. It looks kind of like this. But if you ever feel unsafe about any caregiver handling your baby, you can always call a nurse in to come check it out. You are welcome to bring cameras and recording equipment to photograph and videotape your delivery, but please ask permission from your care team before recording. Please note that we do not permit video recording of surgeries in the operating room. Once you've recovered from your delivery, we'll move you from our labor room into our postpartum room. Typical stay for a vaginal delivery is around 24 hours. A typical stay for a cesarean delivery is around 2 to 3 days. While you're staying with us, we have a variety of food options available. You'll be getting meals provided to you 3 times a day. We do have a ordering system, so you're welcome to look through our menu and decide what option feels good for you. Your support person should bring his or her own food while you do stay with us. Here in the Childbirth Center, safe sleep is really important to us because we know it's really important to you too at home. Our Halo Sleep bassinets are excellent for safe sleep practices. The baby should always be placed on his or her back to sleep, not on the side, not on the belly. These nice yellow clasps need to be fully engaged if you are walking in the hallway. Your baby should always be in this bassinet if you're walking in the hallway. Another thing to watch out for is the locked position on the bassinet. It should always read locked if you are in the hallway. If you are in the room, it's okay to turn this off and move these clips to the side so that you can access your baby while you're in bed, just using the weight of your arms to lower this lid and be able to reach out and grab your baby. In each one of our rooms, you'll have a call light. If you do need assistance from a nurse or a caregiver, press the nurse call button and one can check in with you shortly. There's also a button to get a nurse on your bed as well. It looks like this one. Here at the Childbirth Center, we're really excited to be able to offer you lactation support while you're here during your stay. One of our lactation support persons is here today, Janet.
Hello, I'm Janet. I'm one of the lactation nurses here, and we're available most days, 7 to 3, and you just ask your nurse if you'd like to be referred to one of us. Most of the nurses are trained really well in starting out babies breastfeeding in that first hour or two after birth. Babies are put to mom's chest and allowed to nurse right off the bat. We do have a pump in every room, in all the postpartum rooms that are available in case you get separated from your baby and need to start pumping, or if baby's having difficulty nursing getting started, sometimes we'll start mom's pumping.
During your postpartum course and before you guys head home, we'll have you complete our discharge education class. During this time, we'll go over all the things that you need to know about you and your care of your baby and yourself. We'll also need you to complete the hospital internal birth worksheet. This is the request for the baby's social security number. Once you get home in a couple of weeks, you can send in the request for the baby's birth certificate, and that requires $20 to be sent to the state, and you'll get a birth certificate in the mail. Before we send you out the door, we'll have to have the pediatrician come evaluate your baby. It's best if you can pick a pediatrician or a family practice doctor that you'd like to see your baby. We'll also do a bilirubin check on your baby to make sure the jaundice level is within safe limits. We'll do a newborn screen, and that's a little poke that we do on the baby's heel to ensure that there are no unknown metabolic diseases that the baby might have. We'll also do a check on the baby's pulse rate and oxygen levels and their upper extremities compared to their lower extremities. We'll do a weight and a hepatitis B vaccine. We'll also check your baby in the car seat before you guys head out the door. Please refer to the PeaceHealth website for up-to-date information on visitation policies and the Childbirth Center. This concludes our virtual tour of the birth center. We look forward to meeting you soon and caring for you and your growing family during the birth of your child. Thank you.